Michigan will receive $10.3 billion in federal funding from the American Rescue Plan. This comes at a crucial time for the state. Its 7-day average of new COVID-19 cases nearly tripled in the last month. Joining us now to start the hour is Governor Gretchen Whitmer of Michigan. Governor Whitmer, welcome to the program.
Thank you. Good to be with you.
What do you make of this rise in cases? The CDC has said that Michigan has the second largest number of COVID variants as part of this rise in cases. Do you think that this is just these variants showing up? Is this more a matter of human behavior, people being lax about safety measures? What's going on as you see it?
Well, all of the above. And here's what we know. COVID-19 still is a very real threat. We're all getting tired of it. We all want to resume normalcy. We have vaccines, which is amazing. What a modern, medical miracle that we have 3 great, effective, safe vaccines on the market, 2 of which, by the way, have a presence here in Michigan. We package and ship them out of Michigan. It's a great moment. We can see the light at the end of the tunnel, but we are still very much in it. We took a pause this fall when our numbers were skyrocketing. We've dropped our positivity rates to some of the lowest in the nation, but now we see that this virus can come back with gusto. And I think these variants present in Michigan are something that gives us a lot of concern. But we know if we wear a mask, if we socially distance, if we wash our hands, we can still push these numbers down while we are vaccinating more and more people every single day. 3.4 million shots in arms to date. And that side of the equation is moving fast, but we can't let our guard down.
Are there particular parts of Michigan, particular regions where the problem seems to be the most acute? I always try to be careful when we talk about a state like Michigan, because Detroit is not Ann Arbor, which is not Lansing, which is not Grand Rapids, which is not the Upper Peninsula. The state is so diverse. Are you finding that certain parts of the state are responding to the pandemic better or worse than others?
Well, at this point, we know that where the variants are, it spreads fast. We've seen evidence of them, for instance, in Ann Arbor, where some of the sports teams at the University of Michigan were contracting it and spreading it. And so the University of Michigan did the right thing. They shut things down quickly to help get their arms around it. But these variants are just so much more contagious. And Michigan has the second highest number of them next to Florida. And anyone who's from Michigan knows this is the time of the year that when people from Michigan go back and forth to Florida, and that could be a part of what's happening there. But we've also re-engaged our restaurants. They're at 50% capacity. I know some states are much higher than that, but that's a more recent development. And we know that with re-engagement of certain things comes the increased risk of spread. And that's why we're reminding everyone we've got to continue to follow the protocols because we are so close to being on the other side of this virus.
We mentioned that Michigan is going to receive billions of dollars from the American Rescue Plan. What are your top 1 or 2 priorities for where you would like to see that money go in terms of what you and the legislature figure out as a spending plan?
Well, first and foremost, we've got to continue to build up our vaccination process and testing along the way. If we want to re-engage, we've got to be able to do on-the-spot testing. We've got to make that available. We've got to support our schools. As I think about the academic recovery challenges that we're going to have as a nation, I know that that is very real here in Michigan as well. So the recovery plan is about shots in arms and money in people's pockets so we can support our families and keep roofs over people's heads. So this is welcome leadership that we're seeing out of Washington, D.C., real partnership. And I can tell you every week since the Biden administration took over, we've had visibility about what we can anticipate so we can build out our vaccination processes. And now we're going to have the kind of resources we need to really combat it and get people back on track.
There are 2 lawsuits that I would like you to respond to, if I may. I'll ask you about them in turn in the time we have left. The Michigan State Senate, which is GOP-led, voted last week to authorize a suit against you after you vetoed their appropriation plan. What is your response to that, particularly if that might affect reopening schools, spending some of the COVID relief, moving Michigan out of the pandemic? How do you respond to that suit?
Well, the Republicans in our legislature tried to tie some of this funding that they should never have done to taking some of the authorities that I've used over the last year to keep people safe. I've been very clear throughout that I am not going to give up those powers. They are inherent to the governor's office. Many governors over many years have used those powers to keep people safe, and they were critical to our COVID response, and we've saved thousands of lives, studies have shown. So we need the legislature to not play games here, to deploy these resources that have been sent to Michigan, because every minute is a minute where people are suffering. Businesses that want to get back online, who need a little help, people who've been out of work, and so many of us who desperately want to get a vaccine. We're all counting on these resources being deployed without a legislature standing in the way or using it as a chit to settle a political score.
Side question before I ask you about the other lawsuit. Your powers as governor have been the target of tremendous hue and cry over the last few years. A very dramatic protest at the state capitol in Lansing where people came armed with long guns, threats against you. We know that there was the plot to kidnap you and do God knows what all to you. Have those stopped, or are you still getting threats?
Oh no, the threats are still very real. Just last week, another person was arrested making death threats against me, but also against President Biden and Speaker Pelosi. I mean, this is part of the environment that we still have to deal with. We lived through it for 4 years with an administration that gave comfort and legitimacy to groups that were intent on domestic terror. And that is still part of the reality that we're confronting. And that's why we need people of goodwill on both sides of the aisle to take a stand and to call it out, whether it's in Georgia or it's in Michigan or it is in Washington, D.C. It is wrong. And people of goodwill need to do the right thing and hold these groups accountable.
That's got to be scary to deal with. How are you handling that?
Well, you know what? I never worry about my personal safety. The Michigan State Police protects me and my family. I'm awfully grateful for it. But what I do worry about are the people that are struggling, the people that are worried about getting COVID, the people who are in the hospital with COVID, people who've been on the front line taking care of people with COVID. This has been a tough year. It has been a hard year for every one of us. And as heavy as my burden feels some days, I know it's nothing compared to the burden many carry every day. And that's what keeps me centered on the work.
Before I have to let you go, I did want to ask you about that other suit that's been announced against the state of Michigan to release information regarding an executive order you issue. They claim that it sent nursing home residents who had been hospitalized with COVID-19 back into nursing homes, and that the state, they allege, is shielding information on that from the public. How do you respond to that before I have to let you go?
Well, I think it's really sad that partisan politics has pervaded everything around this public health crisis. And we have, I think, done very important work around nursing homes. Studies have shown that our policies saved a lot of lives in nursing homes as well as in the general public. We followed the CDC guidelines. Any nursing home that did take a resident back, we worked with them to make sure that they had all the safety protocols. It was their choice. No one was mandated. And we have shared all of the information that has been mandated by the federal government, which is a lot, publicly. So our nursing home story, like everyone's, is sad because this is where this virus thrives and has taken so many lives. And yet the Michigan experience has, I think, been stronger than that of many other states. And so this is sadly politics pervading our public health still. We're not going to get distracted. I'm going to stay focused on getting my state through this tough time and keep moving forward.
Michigan Governor Gretchen Whitmer, I appreciate you making time for us tonight. Thank you very much.
Thank you.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.